Hi folks, I'm Matt Chambers and this is FYI for your information. Thank you so much for joining us this afternoon. We're coming to you live on KMOV's Facebook page today to explain how you can give the ultimate gift of life to someone in need. At this very moment, more than 100,000 people in the United States are waiting for a life-saving kidney donation. That's the latest estimate. And some of those kidneys will come from living donors. Yeah. The process to become a living donor is easier now than it ever has been, thanks in large part to a new online. Help me flesh this out a little bit today is Dr. Krista Lentine. She is the medical director of living donation at SLU Hospital. Dr. Lentine, how are you?
I'm doing great, Mike.
So if you missed it during the noon broadcast, right at the tail end, we only had about 2 minutes to discuss this. So it's nice to have the flexibility of the platform of Facebook here to really talk about this. And if you have questions about living donation, about kidney donation, here's an expert at your disposal for the next 15 or 30 minutes. I've got my tablet right here. Just post your questions down below. I'll start here the same way I started on the noon broadcast. I think to the general public, myself included, you hear the phrase organ donation and there's a particular, that conjures a certain image. And typically it's, mom or dad signed the back of their driver's license and they agreed to donate organs once they were deceased. What we're talking about today is, that's critically important, but what we're talking about today is living donation. Explain why that is so important and so needed right now.
Sure, Mike. Well, again, for our I think it's important to provide a little bit of framework. So when the kidneys fail, the treatment options are dialysis or transplantation. Mm-hmm. And transplantation provides the best outcomes because it increases, frankly, lifespan and the ability of patients to get back to normal functioning. But among the transplant options, living donation provides even better outcomes. And the reason is, as we discussed at noon, twofold. It can allow transplants to waiting time on dialysis, which can have some risk to the patients. And also organs from living donors tend to work best because the donors are healthy and because there's less injury to the organs in the procurement process from a living donor.
And obviously, and we'll get into this in more detail in just a little bit, it's not as if you can take any kidney from anyone and necessarily put it in someone in need. It's a much more detailed process than that, but they've got it down to an actual science that we'll talk about. Issues here. There's the demand for kidney donations, which is always high, and always seems to outpace supply. So of course, adding living donors to deceased donors helps with that. But it also sounds like the outcomes for the recipients of those organ donations are better when the organs come from a living donor.
It is, and that's really well established in the medical literature. So it's an important message for kidney patients to understand as they understand the treatment options.
That makes sense. So some things that may seem like foolish questions to you, but this is to I always try to think, what would those folks watching right now ask if they were in my position? So let's talk about a couple of things. For example, give us the most recent numbers we have in terms of the number of people that are waiting on a kidney donation, and maybe within the last year or so, the number of donations we've actually been able to provide.
Absolutely. So as you mentioned, Mike, there are close to 100,000 persons on the waiting list for kidney transplants, and that's just indicating this very waiting in our state of Missouri, many of whom are listed at transplant centers in St. Louis. Last year in this country, there were 17,000 deceased donor transplants, and remarkably, and we should celebrate, that was actually a milestone number, even in the face of the COVID-19 pandemic.
Given the crazy year that it was.
Exactly. Yeah. So that's really something the community has celebrated. In terms of numbers from living kidney donors, that number has ranged from 5,000 to 7,000, but importantly, the benefits for patients.
So that 5,000 to 7,000 is included in the 15,000 number?
No, 17,000 deceased donor and 5 to 7,000 additional from living donors.
So just in 2020, topping the 20,000 mark.
Yes,
that does seem like an important milestone.
Exactly.
So let's talk waiting time. From the time that it becomes apparent that an individual needs a kidney transplant, what's the average wait time if they're ever able to get that transplant?
Sure. So waiting time, it does including the patient's blood type, that there is some priority in the national allocation system. So the factors include how long a patient has been waiting on dialysis and some measures of medical priority, for example, sensitization or antibodies in the blood. But the average waiting time in our region can vary from about 3 to 5 years, and across the country can literally be up to a decade.
Wow. Yeah. And these people are suffering mightily and health decline. I think there's also this fallacy among the public that, oh my gosh, once you get a transplant, you've reached the goal line. Your life is great now. You're never going to have another medical care in the world. Not only is that not true in case of medical treatment moving forward, but your donated kidney won't necessarily last forever. How long does a donated kidney typically last?
So a transplant, it's a treatment. It's an important and life-saving treatment, but it's not a cure for kidney disease. And so the organs do have a finite lifespan. Average about 8 to 10 years, but importantly, 50% of patients who receive living donor transplants can have those going from 15 to 20 years. So in general, a much longer average lifespan with the living donor transplant.
It's a good number of people watching, and we really appreciate you. By the way, this is Dr. Lentine, whose area of expertise is live kidney donation. So if you're just joining us, that's what we're talking about today. Super important topic, and this was on my list a little later on, but since folks are asking it right now, oh gosh, I lost it. Here it is. This one's from Laura. She says, if you're a match, would you need to take a lot of time off from work?
To be
a donor, I presume, would be the
Sure.
The
so and one important innovation regards the donation surgery. So the surgery is now as a standard of care done by laparoscopic approach, and we have excellent laparoscopic surgeons at St. Louis University. So that has really improved the recovery time. Living donors are typically in the hospital. Medication tends to be oral medications. But we do encourage folks to take some time off from work to allow the incision to heal well, and recommend taking about 4 weeks off from work. And that can vary on the type of the job. Often some of my donors who do computer work are up working on their computer at home pretty early.
Gotcha. Oh, that's
but we don't want folks essentially lifting and risking any pressure on that incision.
Low exertion for a while. This is a pretty significant surgery. I have more questions sort of about what makes a good donor here in a little bit, but I for a moment. What makes a good candidate for a possible kidney transplant in terms of the receiving?
Sure.
end?
So both the living donors and transplants undergo a very careful health assessment. For transplant candidates, we need to make sure that they're healthy enough to undergo surgery. That often involves careful assessment of the heart to be sure it's safe to undergo anesthesia, and just to ensure that folks are healthy enough to do well with the immunosuppression medicines that are required to keep anyone with any interest to come forward for a transplant evaluation. It's been shown that candidacy really is expanding. Older patients, patients with diabetes, low functional status can do well with transplant, and also the process of the evaluation itself has some benefits, and it's been shown that undergoing evaluation, even if folks don't go to transplant, can improve health, and it may be that access to specialty care.
Tina jumps on our Facebook Live here on KMOV's Facebook page and says, I'm a living donor.
Awesome.
With a great gift. So let's shift the focus a little bit here to the donors. It can be daunting, obviously, for a number of reasons. You don't need me to tell you that, but to say that it's a thorough process to make sure that you're going to be a good fit for a potential recipient would be an understatement. So let's start with what sort of medical information will be needed from someone that might be interested in donating.
Sure. So donors do undergo a very careful medical assessment because we need to ensure both that the process is as safe as possible for the donor, and also ensure decision making to ensure it's a good choice. But getting back to our topic today, Mike, again, we are really excited about this online tool because it can remove one barrier and introduce efficiency in the process. So that basically, if folks are interested in donation, the process starts with contacting the transplant center, and intake coordinators are available during business hours, but we've recognized that making the process more convenient, reducing barriers, is really well received by patients and can health assessment from the comfort of their own home.
At their leisure. That's,
leisure.
That was one of the points of inviting you into the studio today was St. Louis University Hospital has created this online portal where whenever it's convenient for you, not necessarily during business hours and so forth, you can sort of start that process, at least express your interest, input some simple information, which then I'm sure goes through a series of checks and balances, and you'd be contacted a short time after that, I would imagine.
Yep.
Yeah, it's a beautiful thing. Anything. There was a time in the cycle of living kidney donation that it was sort of understood anecdotally that you would have to be a close relative a parent, a sibling, an aunt, uncle, so on, someone that's genetically close
Right.
to the person that needs the kidney. Is that still the case, or have we graduated beyond that?
Wonderful question, and we've advanced a lot in that regard. So the first living donor transplant was from identical twins. That was back in the 1950s.
Identical,
before,
so literally genetically identical.
And
Yeah.
that actually, suppression being related is not required at all. And another important point is, so there is a concept of biologic compatibility, meaning that blood types are compatible, and that the recipient does not have preformed antibodies against the donor's tissue. But another important advance is what's called donor exchange. So if there's individuals who want to donate to a friend, to a loved one, but they don't meet this biological compatibility criteria, allow transplants to happen. So that's been the latest advance. Really, basically, any healthy person can help a patient in need.
So to be clear, for example, to use this online portal, or just to go shopping around online, if you're interested in more information, we'll give you a great website in just a little bit. You don't have to have a recipient in mind. You could just get on a registry, so to speak, right?
Exactly. So that's
Yes.
a concept of non-directed donation, and just saying that folks who and make a number of transplants happen. So that's really just a wonderful gift.
Because let's be honest, there are risks. Anytime there's a medical procedure, there are risks involved, and you have to be very honest and upfront and forthright with potential donors. What are potential risks for a donor?
Sure. So one of the biggest risks is just undergoing surgery. There's some risks related to anesthesia, bleeding, infection, like within any surgery, but notably the risks are lower than kind of standard low risk surgery things, and that's explained very, very carefully. But the expectation is that after that surgery, that folks who are approved and are healthy enough would have a completely normal long lifespan.
We called this earlier the ultimate gift of life. I don't think that's an overstatement. I don't know how you could possibly overstate this. So you're already asking a great deal from a potential kidney donor. What about the financial repercussions of this? Does that fall on the donors?
Do not pay persons to serve as living donors in this country. That does occur in some other countries, not here. But there can be, unfortunately, the way the system has evolved, some financial burdens to donors, for example, related to travel or lost time to work or dependent care. So removing those barriers to make donation cost neutral is a really important initiative. And there's a number of things going on in that regard. Missouri has to living donors as one. Also, the federal government has really recognized this as a key issue, and there was an executive order signed in July 2019 called Advancing American Kidney Health, where the federal government made some increased investment in removing financial barriers to living donors. And just one important one to highlight, there's something called the National Living Donor Assistance Center that was established a number of years ago to cover travel to donors, but the new initiative is to also cover criteria, but we've really, frankly, jumped on that as soon as it's become available. Folks work with our social worker, submit an application, and it has helped make transplants happen for us even in this year.
I know you're very excited and very proud of these legislative advances. You should be. You were even in D.C., weren't you, for the signing of this?
I was for the signing.
That's what a point of passion this is for you,
Yes.
and I really appreciate and admire that. Let's flip the script a little bit and look at this from a person's perspective who needs a kidney donation. To approach someone, like, this is so far afield from my experience, to approach someone and say, I need a kidney. Are you interested? I mean, at the end of the day, that's kind of what you're doing.
Sure.
That's a big part of your work, is helping people that might need a living donor get that word out or approach someone specifically, right?
Absolutely, and really that difficulty in making that ask is likely one of the largest barriers to feel uncovered. How can you ask someone to make the ultimate gift of life? So there's a number of initiatives that we in the community have undertaken to try to make that ask easier. One is a partnership with the National Kidney Foundation. It's called the Big Ask, Big Give, and it's workshops that we hold a couple times a year where patients can come with family members of their social network and learn how essentially to empower family members to act off the patient.
You mentioned the word champion. I know kidney champion or donor
Exactly.
champion. Explain to me what that entails.
Yeah, so it's really just an individual who's taken on this role of advocating for the patient in the community, making the ask, sharing about their need. It can often be done through social media, and we provide training in that regard, how to do that safely and appropriately.
Guys, I'm going to give a last call here for any questions you might have for Dr. Lentine. Our topic on KMOV's Facebook page today is living organ donation. Organ donation in general, there's an expert sitting on our couch. You're not going to get this opportunity very often. So again, we appreciate your time. I want to circle back to the donor portal that's now alive and up for
Yes.
people to check out online, and how much easier that really makes this process for folks. Just explain that one more
Yes,
time.
we've just launched it and found that people really like it. So essentially, folks enter some basic information, and it has some smart logic. Exclusions to donation, diabetes would be one example. Then the process stops and they're given some follow-up and information and health advice. But if these thresholds are passed, it moves through increasing levels of the evaluation, and then they're set up for a conversation with our nurse coordinator.
So it's an important first step.
Yes.
And again, can be done from your kitchen table, from your living room, from your bedroom, right before you go to bed at night. It's on your time. And here's the beautiful thing, whether you're watching this live or you're watching in the comments below, more than once, the link has been shared, and so I'll do that again for everybody right now. I would strongly encourage you, if you are even considering this, to check out the new online intake tool for potential donors. It's Living Donor SLU H. Living Donor SLU H, as in sluhospital.org. And if you're just looking for more information, you want to kind of dip a toe in the water, you're interested in transplants, how the whole process works, maybe how to become a donor, go to ssmhealth.com/transplant. So two important websites there, ssmhealth.com/transplant and livingdonorsluh.org. Doctor, thank you so much for your
Thank
time.
you,
We
Ray.
appreciate it. You're doing some amazing work, answering some difficult questions and dealing with people in some of the most difficult ordeals of their lives.
We
So,
appreciate the opportunity to share so much. Thank
well,
you.
it's our pleasure. And hopefully we get some people interested. I'm interested. I really want to explore this a little farther. Thank you, all of you, so much for joining Dr. Lentine and I here on KMOV's Facebook page. This has been FYI for your information.